And then I will introduce the first speaker. This is Dr. Purushottam, who will discuss tango technique assisted retrieval for teaching cerebral cover filter. So thank you. Thanks for the invitation. So what I'm going to show is a patient with a malpositioned tilted IVC filter and with penetration to the roof of the left renal vein and the sacral aneurysm, and how I use this tango technique to successfully retrieve it. Nothing relevant. So it's an 81-year-old woman with multiple DVTs. She had a filter placed because she had a hemorrhagic stroke, and then eventually she got cleared by neurosurgery, got started on anticoagulation, and then, she moved towns, and her primary care doctor started investigating for abdominal pain. They did a detailed evaluation. They really couldn't find anything, and so they said most likely it could be the filter. So I thought it should be pretty straightforward. So I got some diagnostic venograms through the right IJ, and right there you can see in this close-up shot that the head of the filter head is kind of right across the roof, the left renal and IVC confluence. The filter is tilted. It's all the way in the juxtarenal position. And you can see that some of the legs are penetrated. So when I see this, I usually stop, get a CAT scan to better evaluate. On this CAT scan, I want you to pay attention to the anterior filter leg right there. It's kind of almost burying itself in the sacral aneurysm. So these are some coronal and sagittal views seeing in relation to where it sits with the left renal vein. So here's a still shot. So here's one of the anterior legs buried into the wall of the incus, and then here was heard again across the renal vein. So went ahead, we did a endovascular repair of the AAA. The idea was to make sure we secure that, and then we did a solid CT to confirm that we did exclude the aneurysm, and also to see where the filter was sitting in relation to all this. So we felt pretty secure. And what we did was initially we came up top with a 9 French sheath and down below from a 12 French. And then took a picture to plan the technique. And so what I'm trying to do here on this picture is I'm trying to get this catheter to kind of lasso around the neck of the filter so I can put a noose. So basically this free wire sticks out. I come in with the snare, grab the free wire, form a tight noose around the neck, and I can drag the filter and dislodge it from the renal vein. So I managed to snare it, but not across the neck. And unfortunately, this did not work. So what I did in the next stage was I used the Raptor forceps. And what I did was I was trying to grab the neck of the filter. And then as I grabbed the neck of the filter, I dislodged it from the confluence. And as I dislodged it, at that point, I decided to switch to a laser because, the way the filter legs were tilting, I knew they were buried quite deep in. And then I was able to hold on to the filter. And I also take a picture at the same time. That's probably a hemiazygous vein to make sure I'm not having any tear or any perfs. So if there is any tear or perfs, I usually hold back or hold off or then consider covered stents. So here I have the tango technique kind of describing. So this is my 18 French gold dry seal sheath. That's the filter snared there. That's my laser sheath. Here's the filter. Here's the forceps grabbing it from below. And then this is a 12 French sheath. That's obviously your EVOR. And I always have a third axis, a pigtail to take pictures at the same time. So doing so, I was able to successfully pull the filter out and then obviously took some pictures. You can see there might be a little bit of a tear there, but usually I watch them. And if the tear persists, then I usually go ahead and consider a covered stent or so. But luckily, I didn't have any of these issues. And then I always take a complete dry cine because often when you examine the filter, you want to make sure you have all the legs and all the parts there. And thankfully, everything went well. And actually, she did well. I mean, her abdominal pain went away completely. We did a follow-up IVC ultrasound. She did have some amount of thrombus, probably at the site where the legs were penetrating through. We put her on some anticoagulation. I mean, she was already on anticoagulation. We followed her up again. After that, we didn't find any more thrombus, and she did pretty good. Thank you.
Thank you very much. I would have a question. What would have been your C plan if this B plan didn't work?
So, the plan was if I have a tear there at the confluence, then obviously covering the renal veins was not an option. So when I usually snare the filter from above and below, and if I see there's some kind of tear, then what I do is I let go of the filter, and then at that point, we probably have to talk to surgery to do what the next step was. Yeah.
Thank you very much.
Thank you.